spirometry is the way to make a diagnosis. So what is spirometry?
So spirometry, as you mentioned, is a breathing test or a pulmonary function test, lung function test. It's usually done with a little machine, handheld, can be done in a lab, but it can be done just in a regular doctor's office or nurse practitioner's office. You put nose clips on the patient's nose. They take a deep, deep, deep breath in and then blast the air out into this machine that measures the flow of air. They blast it out long and hard as they can, blow as long and hard as they can. The amount that comes out in that first second is the term forced expiratory volume in 1 second, or FEV1 you hear people talk about. So that's the amount that comes out in the first second. The total amount that comes out is called the FVC, or forced vital capacity. So the amount that comes out in the first second versus the total amount in you and me is about 80%. But in somebody with COPD, that's low because they have trouble blowing out that initial air. If you give them long enough, they can often blow out air like you and I can. But in that first second, it takes them longer. So the FEV1 to FVC ratio is low. So a spirometer is just a breathing test that measures those numbers so that healthcare professionals can tell whether a patient has COPD or not.
So in my office, I have a portable spirometer, and we do the test, and then the machine prints all these numbers. And it's kind of scary to see all these numbers. I always wonder if I'm missing something. So what are the major points, or what are the major areas that I should be looking at? Why should I be paying attention when we do this test in my office?
So patients really should care about what their FEV1 is based on their height, gender, age, and ethnicity. So obviously, if you have some tall basketball player and some really short stature person, they're going to have different values of the lung test. And so you look at the percentage based on that particular person's age, height, gender, and ethnicity. So we look at percent predicted, and we like it to be 100%. Everybody likes 100 on a test, but we accept down to 80%. Once it gets lower than that, then we start thinking that there may be something going on in the lungs. So you look at the FEV1, the FVC, and then that ratio. There are a lot of other numbers on the test, but those are really the three things that are really important. The FEV1 to FVC ratio, after you use the puffers, the bronchodilators, the things that open up the airway, if that is less than 70%, then that is consistent with obstruction. Okay? And so in order to make a diagnosis of COPD, then you have to have that post-bronchodilator FEV1 to FVC ratio of less than 70%.
So a ratio less than 70%, we're confirmed there is an obstruction process there. And how do the spirometry is going to help me to assess the severity of the disease?
Well, the worse the FEV1 percent predicted is, then the worse the COPD is. So if your percent predicted is only 15 or 20% of somebody your age, height, gender, and ethnicity, that's really, really bad COPD. Whereas if it's around 60, 70%, then we consider that more in the moderate range.